Hello and welcome, everyone. We're just waiting for our registrants to join us. We'll start in just a minute. All right, well, welcome everyone. My name is Jessica Collins. I'm the Executive Director of the Public Health Institute of Western Mass, and really grateful for everyone's participation today in our webinar, which is part of a series that is part of the City of Springfield's celebration of Public Health Month, founded and led by the City of Springfield's Commissioner Helen Colton Harris. And this year's theme is We Are All Public Health. And today we are highlighting work regarding climate justice and healthy air. And we are so grateful for the ongoing and invaluable partnerships with regional and municipal colleagues, as well as Yale University and Dr. Krystal Pollitt, who we'll hear from later. Our region is truly innovating and demonstrating deep community involvement to solutions that are and will continue to be replicated around the Commonwealth, the country, and our world. And we are very, very proud of this work. Just a few housekeeping points. If you have technical difficulties or need help, please send a direct chat to one of the hosts. We are recording the webinar, and this recording will be emailed to registrants and be posted on the Public Health Institute website. There will be a brief question and answer at the end, so you could submit questions using the Q&A feature on your Zoom menu bar. If you would like to enable automatically generated captions, click the closed caption button on your Zoom webinar options, and note that sometimes these are not always exactly accurate as they are automated. When the webinar ends, we will be asking that you just take a moment to fill out a brief survey, 1 or 2 questions, and we do always appreciate that feedback. So thank you for coming, and I would like to hand it over right now to Samantha Hamilton, our Director of Coalition Building and Community Engagement.
Hello, everyone. Welcome. My name is, again, Samantha Hamilton. Thank you for joining us. I am, like Jessica mentioned, the Director of Coalition Building and Community Engagement. Specifically, I lead the Live Well Springfield Coalition. So today I would like to share a little bit about the coalition structure, ways we operate, and our efforts to advance climate change and health equity in the city. So part of our work is all about empowering and supporting our community residents and lifting up their voice. So I want to set our intention today by just kind of highlighting a quote from one of our resident advisors, Amari Dewberry, who works in our climate justice initiative. So Amari says, "It's a matter of providing the avenue for power, and it's a matter of stepping back and allowing people a chance to grow their own interest in their environment." So our goal today is kind of share a piece of what we're doing in hopes that you find your own alignment and own interest in taking action, getting involved, or learning more about the work that we're doing. So our desired outcome for this presentation around the initiative is to have a shared understanding of the Live Well Springfield Coalition and our climate justice initiative. Have an understanding of the coalition efforts to advance community choice energy in Springfield, which recently had some big wins, and a shared understanding of coalition's future efforts to address health equity and advance health through an environmental justice lens. So Live Well, we created this visual to say it's an umbrella. Live Well is a coalition which has an umbrella of initiatives that we're focused on. So the coalition consists of 30 or more community-based organizations who work with us under this umbrella to advance any of these initiatives. And these initiatives our goal is to nourish a holistic approach to health, that encompass health equity, climate justice, advocacy, active living, the built environment, and economic opportunities for housing and education. So the initiatives that we focus on is an age-friendly initiative that looks at older adults and how our livability, how do we age throughout the lifespan. Our Clean Slate Western Mass initiative, who's looking at addressing the equitable barriers of accessing resources due to a past criminal record or quarry record. The Transforming Communities Initiatives, or TCI, which is focusing on housing access based on housing initiatives, focusing on affordable housing, livable conditions, and efforts to help homeowners. And lastly, our climate change and health equity, which we're going to go deeper into, which is focused on in our environmental justice efforts. So the Climate Change and Health Equity Initiative consists of our community-based partners, Pioneer Valley Planning Commission, Rise for Social Justice, Wayfinders, and the Public Health Institute. And our efforts have been funded through the Kresge Foundation over the last 3, now going on 4 years. Our first year, our planning year, was a year in which we focused on narrowing and identifying a policy priority that we'd be working on in the city. And the remaining 3 years have been focusing on implementation, our efforts to advance change across the city. And it comprised, our coalition also is comprised of community-based residents. We have about 9 community-based residents in our work, and 2 stakeholders or partners that feel vested in advancing climate justice work in our organization. So that's the structure. So to highlight our work over the last couple of years, this visual kind of show how we went from identifying a policy priority to advance climate justice work. We used the Springfield Climate Action and Resiliency Plan in the beginning that had 161 policies around addressing greenhouse gas emissions, improving health outcomes, addressing equitable barriers for individuals and families living in Springfield. We did a housing and transportation prioritization because our focus for our Kresge grant was focused on housing and or transportation, and narrowed down those 165 policy priorities or policy ideas to 26. And from that, we were able to do a feasibility study and research to understand, okay, what is truly possible? Are there any initiatives that have momentum in our community? Are there strong alignment with other community-based organizations advancing change? And our work narrowed it down to 14. At this point, we are engaged with our coalition, again, our community-based partners and residents who worked with us to do a prioritization process, which looked at how each of these initiatives would advance our health, address greenhouse gas emissions, and improved community access in our community. And we brought that down to 4 strategies that we then brought out to the community, the broader community, for feedback and input. And we created informative videos, created fact sheets for folks to kind of learn more about how these policies impact and advance health, and what initiatives they would rank them, what initiatives they thought would be the most important and pressing for our community to work on. And we landed on 2 specific ideas that came out of that process after the ranking. And our advisory committee provided additional feedback that we decided to implement in our grant initiative. So the first one is around community choice energy. And as you can see, this is an example of our fact sheets that we've used, or informative infographics that we created to help kind of break down how community choice energy would advance our address greenhouse gas emissions, advance our quality of life, and so forth. So, but community choice energy, and sometimes folks call it community choice aggregation, is a program where the city of Springfield would set up and switch everyone in the city for basic Eversource electricity to clean energy solutions like solar and wind. So we would be asking the city to make a commitment to invest their time and effort in providing this option for residents that they have the power to opt in and opt out of over the life of the program. So our goal in the beginning was to advocate for more awareness about community choice energy, get folks to sign on to a community petition and support, organize and rally community residents to learn more and mobilize and speak up about why community choice energy was an important solution for our community. The other initiative that we are currently in the process of kind of developing and building out with at the end of the year of this grant initiative is a race and health equity impact assessment. So this idea is that a race and health equity tool, or it's a screening tool, will help us address barriers of access in our community. So the race and health equities tool examines and how a different race and ethnic group would likely be affected by proposed actions or decisions. These tools can be applied across departments from housing, education, transportation, public health, and beyond. So we worked through this process so far, and equity is a big thing that we want to advance in our community. And we've narrowed down to the idea of considering a community benefits ordinance strategy as a race and health equity tool, and exploring with the community how the possibility of reparation solutions could also address race and health equity. So we are in the midst of this initiative, this part of our grant. So we have not kind of reached any successful results yet, but we are in the process by the end of this year to have some wins along with our community choice energy efforts. So what has happened so far with community choice energy in the city of Springfield was that in December of 2024, the city council unanimously approved the process of community choice energy to go forward in the city of Springfield. City council have the process to approve, and once that is available to us, then we go into the city government, who then have the authority to proceed with then the next step of the community choice energy process, which then happened in January of 2024, where the city put out an RFP for an aggregator. An aggregator is also known as an energy farmer. So, someone would work on behalf of the city to help us identify clean energy solutions, put together a proposal, submit an application to the Department of Public Utilities, and then provide energy options for residents that all residents would have the immediate opt-in function, but then have the power to opt out at no charge or no cost. Through this process, our campaign efforts have been focusing on that with the increase in utility costs across our state and within our city, that community choice energy is a great solution for price stability. It will not solve our energy crisis. It will not address all of our energy and utility bills, but it will provide some relief for families that have been struggling with maintaining and regulating their energy bill expenses due to the influx of the rates and the price across the state. So lo and behold, as of this week, literally yesterday, we had there was a press conference held at the city office where they announced the hiring of Colonial Power as the aggregator for community choice energy, and that we are in the midst of the process of doing community listening sessions or community comment sessions where folks can now comment and provide input on what they think and hope the plan would look like. Our advocacy for work at Live Well Springfield and under the Climate Change and Health Equity Coalition is the option to have 100% renewable option choice for residents. You know, this program would have folks opt in, but we want to make sure that the tiers that are available to folks have the option for 100%. Rates can start at 75, 50%, and it's customizable based on the residents' needs and wants, but our advocacy is for that big type of change. So we're happy. This process also takes time. I want to recognize that we've been doing this work over the last 3 years, And these milestones have a lot of different stepping points into it, and includes having strong relationship with city government and working with city officials. So going forward, our goal is to continue to advance climate justice work in our city, working with our municipal government, working with strong community-based partners to advance this work. So we recently submitted an application to the EPA around applying for a grant that would advance and reduce greenhouse gas emissions, reduce pollution, and climate resiliency. So this grant application was submitted with city staff and community-based partners. This was an extensive process, but our goal is that with this collaborative effort, with the strong momentum, with the also great work that has been happening in the past with the CARP, the Climate Action Resiliency Plan, that we are positioned to be the right community that could take on this grant proposal and improve our community overall. In our application, we kind of broke down our efforts into 2 tiers of interventions, environmental interventions and community engagement. We are hoping to do some tree planting, complete streets, bike shares, community resiliency hubs, housing retrofits and remediation, community solar, job training for clean energy job solutions, and air quality monitoring. This is where our coalitions, our healthy air work, and our climate justice advocacy work cross over, because we'll be working together to advance those efforts. And in this work, we also will be spending a lot of time in our community, informing them about the efforts, engaging community residents, having an advisory board, a climate action and resiliency plan that we're going to update. Remember, we did that plan a while ago. The 156 strategies have actually, most of them have been accomplished. We would hope to create a new community action plan that would have new strategies bringing us forward into the future. We'll have some communications dashboards, some climate navigators that will help local residents understand the needs of how to get connected with the housing solutions, and capture some of the impacts through our Photo Voice project and evaluate the process. Again, these efforts would reduce greenhouse gas emissions, reduce our pollution, as us being a valley that have a lot of air pollution, and increase climate resiliency. And some of the actions and the impacts that we hope to have is that we're going to address environmental challenges. We're going to strengthen our community through our connectiveness and our resiliency. And we're going to establish a framework of this multi-sector community engagement process, because a lot of partners are going to be involved and a lot of stakeholders are going to be at that table. We're going to address systemic barriers that prevent people of color and underserved communities that are burdened by these environmental justice issues. And then we're going to build community capacity by taking advantage of these meaningful change. So more folks would have an understanding and more folks would have the power to seek out other funding to advance this work. Another way to look at our work is through this visual model of how it all ties together. This work will be led by our Live Well Springfield and City of Springfield partners. We're the lead partners on the project. It will encompass a strong advisory committee of residents and partners from Wayfinders, PVPC, Arise for Social Justice, local neighborhood grassroots organization or anchor institutions to help us, and we'll have working groups. So again, all of this, efforts is to, develop these communication plan, to update our climate action resiliency plan, to outreach and inform the community about the EPA project throughout the years, climate action and pollution reduction, mini grants. So this is an element that we included in the proposal that will set aside funds for small but mighty organizations who are looking to have an impact in the environmental justice space, to create projects within the 3 years of our grant to advance and improve our community. And again, we'll use evaluation using this Photo Voice project to see and show the impact and how community are seeing the impacts of climate justice work in this effort. So those are the projects. This is where we're going. We are grateful and excited for what we have accomplished so far. If you have any questions about this work, please feel free to contact myself. We have been doing this work for the last 4 years, and we learn so much more, and we create stronger partnerships. So we hope to kind of continue to do that over the years. So I'm going to pass this to another colleague that's going to talk about our healthy air work and how that work advances our change.
Hi, everyone. I am Francheska Bermudez. I'm the Healthy Air Network Program Coordinator, and so we will be sharing an overview of who we are, what the Healthy Air Network does, and my colleague, Krystal Pollitt, will come in halfway through the presentation. So here, we started this project before the pandemic due to some funding from the Attorney General's office because of high levels of asthma. There was a need for air quality monitoring because of this. And so we wanted to be grounded by community organizations in our area and have a robust group of resident advisors to guide us in this work of air quality monitoring and air quality issues in our region. So here you can take a look at some of our community partners, but really who run the show is our advisory board, our community residents. So first I'll play a video for you all.
We are the Healthy Air Network, and of course, we advocate for healthy air for everyone.
We are the Healthy Air Network, and of course, we check the air quality daily.
We are Healthy Air Network.
Of course, we do demonstrations.
We're from the Healthy Air Network. Of course, we're going to ask you to put an air sensor on your building.
We are the Healthy Air Network, and we use every chance possible to talk about air pollution.
We're from the Healthy Air Network. Of course, we know trees clean the air.
Somos de la red de aire saludable y sabemos que los árboles nos ayudan a respirar.
Somos el Healthy Air Network y nunca dejamos nuestros carros corriendo parqueados.
We are the Healthy Air Network, and of course, we care about healthy air.
So those are some of our resident advisors and some of our partners. And so we really come together to really focus on air quality across the valley with this statement of everyone has a right to healthy air and a safe environment. And we really hold that to our hearts. And so why does air quality matter in the grand scheme of things? And it really comes down to our health. Air pollution affects our health. We have to breathe to live, and we struggle to breathe when there's pollution. So here are some folks that are the most vulnerable to poor air quality. And air pollution affects everyone differently over time. There are day-to-day impacts that are especially hard for folks with asthma or illnesses, but there are also some long-term problems that you can be exposed to if you are exposed to air pollution. You can develop asthma if you've never had it. Air pollution can reduce the lung size and function, which can lead to premature death. And so why Western Mass? Why Springfield, Holyoke, the Pioneer Valley specifically? And so here's some data of who's more likely to be in the ER for asthma. So Holyoke and Springfield residents are 3 times more likely to go to the ER for asthma compared to the state. And so why? This is the main reason why we wanted to do air quality monitoring in our area, to see why is it so bad. And here's some other data regarding children in Holyoke and Springfield. So out of 20 kids in a classroom, in Holyoke, 4 would have asthma, 3 would have asthma in Springfield, compared to the state where 2 out of 20 would have asthma. So we all know that the climate is changing, whether it's extreme weather events, as is tornadoes, heat, snowstorms at the wrong time of the year. This disruption of the climate can be felt in many ways, especially with extreme heat. So based on some projections, Springfield might have a month of 90-degree weather in the upcoming years. our houses and schools are not built for this. We don't have AC in most places, and the heat impacts even more the illnesses mentioned before. So those that do suffer from asthma and lung diseases and conditions, it really can make it harder to breathe when it's a really hot day out. So with all this background regarding asthma and extreme heat and air quality, we really wanted to do air quality monitoring in our region. So we have this Healthy Air Network website, which you can view from a phone and a computer. And we have sensors in our region to see what the air quality is in different places in our region. And so these air sensors measure air quality and PM 2.5 and all the sciencey stuff that I will let my colleague Krystal Pollitt talk about.
Thanks so much, Francheska. So let's take a little bit of time just to give some background for why we need to measure air quality and why we're so interested in getting just so many monitors across the region. So what I'm showing here is what's currently being used by EPA to monitor air quality. And when we're measuring air quality, we're measuring a specific type of air pollutant called PM 2.5 or fine particulate matter. So these are particles that are less than 2.5 microns in diameter, so incredibly small, a fraction of a strand of hair. And you can see that all of these yellow markers are where there are points where the EPA is measuring this air pollutant. And if you go to the Western Mass area, there's a lot of gaps in where we were able to know what concentrations of this air pollutant are. And if we go specifically to the area where Francheska was talking about, we have one monitor in the Springfield area and then one across the way in Chicopee to capture the whole region with this valley that Samantha also alluded to has a topography that lends itself for more air pollution to accumulate with higher levels. So with that, we were looking at ways that we could expand this network. And if you could go to the next slide, Francheska. I'm showing why we want to expand it. So this is a map of London where they have modeled how much variation you can have for PM 2.5 mass concentration. The higher levels here are shown in reds and the lower levels are shown in more of a bluey green. And you have these red lines that are going across the city where you have a lot of variation when you have traffic related sources and other burning related combustion events. And if we only have two monitors, one in Springfield, one in Chicopee, we're missing all of these, what we call hyperlocal changes, variation within air quality. And so our goal is to be able to put up more monitors across the region so we can capture all of these differences across space and be able to then communicate those, especially to those that have the greatest need and the most response adverse impacts from air quality. Okay, if you could go to the next slide, please. So there has been a growth of interest in using lower cost tools rather than the instruments that are used by the EPA that are tens of thousands of dollars to use tools that are on the order of $200 to $300. And there's one of these types of monitors specifically called purple air sensors. And you can buy these, they're commercially available. And there are many citizen scientists and scientists that have placed them up across New England and internationally as well. And I'm showing a map here of where the EPA monitors are in red and where the green dots are where everyone has installed these lower cost sensors. All you need is power and Wi-Fi, and you can connect these monitors onto a map to see what the levels are. And they'll give you real-time measurements every 2 minutes. If you go to the next slide, please. These sensors will cost commercially $200 to $300, but the only thing that they're using to measure particles in the air and to estimate PM 2.5 mass concentration are two $5 sensors. And by having two of them there, it gives a little bit more confidence. If they're measuring the same, reporting the same measurements, then they're likely correct. But there's a lot of questions about how this $5 tool can compare to a $50,000 tool. So a lot of our motivation for establishing a network that uses these low-cost sensors is to make sure that we're actually getting the right measurement that we have confidence in. And we spent a lot of work and effort to be able to make sure we're getting the highest quality data with these $5 pieces of kits. Can you go to the next slide, please? All right, so a little bit of background about how these work, because that will give an understanding on how we make sure we have high quality data. So within each one of these devices is a really simple way of how they measure it. So they have a laser that's shining lights, and then they have a photodiode detector that will capture if the light is present. And whenever it captures light, there'll be a change within the voltage of this director. So if there are no particles, there's nothing that's bouncing this laser onto to reflect it into the detector. However, if you have particles that are present, it's going to scatter that light from that laser, and it's going to shift it onto the particle detector, and that's going to change the voltage that's detected. So very simple optical means for measuring these particles. So if you go to the next slide, these can work fairly well, and these particles can scatter light, and we can measure it for some types of particles. But particles are not equal. There's lots of different sizes of particles, different shapes of particles. They're made out of different types of chemicals, and that's going to change how that light is scattered. And it works far better for some smaller particles compared to all the particles that make up this PM2.5 size that the EPA regulates. And what I'm showing here is if we look at measurements that are collected over time for really small particles, PM1, so less than 1 micron in diameter, you see that all of the lines that are shown on that very first panel there agree. We have a measurement from one of EPA's measurements, and then 3 low-cost sensors. So they do well. But as we start looking at larger sizes of particles, like PM2.5, or even those that have 10 microns in size, you can see that those lines start to deviate from one another, signaling that the sensors are not measuring everything that is there. And we have to apply some factors, so some adjustments to how that sensor is operating. If you go to the next slide, please. So we can measure particles that are sized anywhere from 0.3 to 1 micron. Well, we can measure it over a really large range of sizes, typical on the lower end of what we see within the Springfield and Holyoke area and many other parts of the United States. But if we want to get that full range of what EPA is measuring, we need to calibrate our sensors. And this is what I'll just spend a moment talking about. So on this healthy air network that Francheska shows the image of in the website, we have 2 steps for how we calibrate these sensors to make sure we have high quality data. Before any one of these purple air sensors that we have on the map within the network goes out into the field, we put them for 2 to 3 weeks at one of the EPA monitoring sites because we want to know how that sensor is functioning to a $50,000 piece of kit. We're looking at how it varies over time and how comparable that data is and how sensor to sensor compares. And so this is a picture here where we have all these different sensors that are going to be placed out into the network at different resident homes and other locations that will all sit at this EPA monitoring station for 2 to 3 weeks. You go to the next slide, please. And so what I'm showing here is how we have these types of relationships and the type of variation that we have sensor to sensor compared to our master sensor. So I'm showing here some what we call scatter plots, looking at measurements if we look at the correlation between them. Along the bottom axis are all the master sensors that we have at the EPA monitoring sites. And then where you see S1 through S9, those are all the individual sensors that are going to be going out to residents' homes and other locations. And some of them agree really well, but others don't. And we have to know how an individual sensor is behaving to make sure that we're being able to apply the appropriate correction to it to get high quality data. So if you keep on going. And to the next slide, please. So we have different ways of then adjusting that data to see how it agrees. And we can use different types of models in different levels of complexities. And we have being able to work together with other scientists that also work with low-cost sensors to better gauge. And what the consensus is that these sensors are really impacted with what the relative humidity is. And if we can account for the relative humidity outdoors, then we can incorporate that into our models to make sure that we can correct our calibrated sensors individually. So what I'm showing here on the left there is if you have different categories or different ranges of relative humidity, you're going to have different relationships between how well the low-cost sensor agrees with the EPA sensor. And we have found for our network what's called a non-linear model that we develop that incorporates relative humidity. And as soon as we are able to adjust for this calibration, we have very good agreement between the low-cost sensors as well to the reference monitors that the EPA runs. If you can go to the next slide. All right, so now that we understand how the sensors operate and we can calibrate them before they go into the field and make sure ongoing that we're able to apply these calibrations with relative humidity as they operate. So we can now apply all of these this understanding to our network as a whole. And this is a section of the map that Francheska showed before. And what I'd like to show is just some highlights from this that we have here. So I'm going to share just some insights into what we found with temperature, three different stories with the data that's come out. So one related to traffic, one related to seasonal variation, and then one also related to wildfires. So I'll start with what we've learned about traffic-related influences across the region using these measurements. And what's shown here is a look at the network across Holyoke and Springfield. And shown on the left is what the network looks like when we are at midnight in the middle of the night. Lower concentrations are in green and higher concentrations are in a pink to white. And you can see when you compare from the left to the right, when it's midnight compared to a time of rush hour, the concentrations look really different. And to orient you across this map, where you see the white concentrations on the right-hand side is downtown Springfield. So highest concentrations impacted by the heavy traffic running through the city on the 91. If you go to the next slide. So we can also trace that more quantitatively with concentrations. And so what I'm showing here are the concentrations that we measured at 3 sites in downtown Springfield compared to 3 sites in more suburban areas outside of the downtown core. And these are hourly averages across the day. So each dot represents an average over midnight to 1 a.m., 1 a.m. to 2 a.m. So then we can look at how it changes across the day. And we call this diurnal variation. For the suburban states, we see a really flat line. So we're not seeing really any distinct sources that are changing how the concentrations vary. But that's not the case for downtown. We see that rush hour times are a point of change. And those start where we have increasing concentrations in the morning as well as the afternoon. So those are key contributors to the levels that we see. You go to the next slide. Seasonally, when we look at these changes, we can also see that there are some other sources that are impacting concentrations. And this is 2 years worth of data averaged across months. The dark lines show the measurements, and then the lighter blue lines just show the amount of variation, the standard deviation that we have across these measurements. And this is starting from March 2022, going all the way until April 2024. So very recent measurements. So over the past 2 summers, we've seen a contribution from wildfires, especially last year. If you remember, very high concentrations, and overall those were reported across the monitoring sites. But in the winter, we're also seeing contributions from biomass that are elevating levels. If you go to the next slide. So when we look at the wildfire smoke, during these times, we had the entire network change color, and those are then proportional to the concentrations that we're measuring. They will go red when we get into an unhealthy air day, and that's also then highlighted on the map there with recommendations from the EPA on what sensitive populations recommendations for where they should be going and what they should be doing during those periods. And if you go to the next slide, I'll just highlight some of these the measurements that we collected. So across Holyoke and Springfield and Westfield, what I'm showing here are just these 2 minutes measurements that were collected across a time when we had wildfires in 2023. So this was in early June, and you can see these concentrations being reported for the 4 sites across the network. We have periods where we have relatively low concentrations, and then as soon as the winds shift to have coming from the north, from the Canadian wildfires, we see a very dramatic increase within those concentrations that persists for a length of time before the wind direction changes. And we saw this across the network and have been able to, we were able to alert residents of the severity of the wildfires as these events were happening.
Thanks, Krystal. And so with all this talk about, extreme weather events and traffic pollution, pollution due to transportation sources, we really want to think about, well, what makes air quality better? What's the positive side of all these negative things that are affecting air quality in our region? And so one thing to highlight is that we really should be understanding the root causes of some air quality issues so that we can create better solutions. So in this healing tree map, really going down and seeing like where in our neighborhoods why are certain neighborhoods built differently? What is their built environment? Are they near highways? Are they near factories and other points of pollution? And really looking at it from a health equity perspective. But here are some examples that we in the Healthy Air Network are prioritizing, such as tree planting. We work with various tree planting organizations, such as Regreen Springfield, to really, plant trees. Trees create a physical barrier for pollutions where pollutants can stick onto the leaves of trees. We want to work on improving public transit to lessen personal vehicles on highways, for example, creating efficient energy sources and really coming at clean energy in our region. So connecting back to the Live Well initiatives that Samantha previously covered. And so what is the network planning on doing from here on out? We want to continue to monitor air quality and related issues. For example, within the past year, we have looked at cement plant proposals in Holyoke, asphalt plant in Springfield that there were some concerns about. And we recently visited a Springfield crematory to really look at how that impacts air quality. We want to learn what is going on and share it with our residents and our community when we have all the facts. We are expanding the network to include rural communities in Franklin County that face wood burning, air quality issues, for example. We want to do outreach to more schools in the Pioneer Valley to involve more of the youth. And we want to expand to eastern parts of the state where there are some communities facing asthma disparities outside of Boston. And our most exciting news yet is that we have been awarded funding to develop a mobile app where you can quickly open and see what is the air quality near you at that moment. So you can check out our website. For the summer's coming up, heat is coming up. Follow the guidance on poor air quality days and avoid traffic when we have those poor air quality days. You can feel free to contact me or my colleague Sarita, and follow us on Instagram and Facebook.
Thank you so much, Francheska. That was so very impressive. And so thorough. And Samantha, also, thank you for your very comprehensive overview of all the Live Well Springfield Coalition work. Very impressive. And I do appreciate both of you calling out the importance of the collaborations and the resident advisory boards, and that work will only deepen and continue. So thank you. So we are now at the question and answer part, and I know that there was one very specific one for you, Krystal, with regard to just explaining biomass. And of course, for the folks who are on with from Springfield, we had a very, specific biomass plant in the city. So could you just explain, first of all, what is biomass and what exactly was your data showing?
Okay, yeah, so that's a great question. To clarify, so when we talk about biomass burning, specifically, I was referring to wood stoves used for heat in residential settings.
So then the chart you showed that had the two biomass, the graph you showed with the two increases in biomass, you're saying that's from people's homes, from wood burning stoves in people's homes, not the specific plant in Springfield?
Yeah, that's right. So we think during the winter periods when we have those higher levels of this pollutant, it's likely originating from people's homes.
Okay, thank you. And then someone did just ask a question in the Q&A very specifically about how to maintain the sensors. What's the maintenance like that for?
So I didn't go into the different layers that we use to maintain the sensors, but it is something that we've thought of. So we have 80 plus sensors that are being operated simultaneously. And again, they are low-cost tools, and sometimes there are hiccups with it. So to help us have a better overview of these sensors, we do have a sensor health dashboard. So it just sees how the sensors are operating. And it tells us, are they connected to Wi-Fi? What's the strength of the Wi-Fi? Are they down? What's the quality of the data that's being reported? And that can send us alerts then to see if we should go check up on a sensor. And because they are outside, there's lots of different animals outdoors that might like to create homes in there. So it's always good to have an eye on how they're working. That's a great question.
All right, thank you. So a previous question that was put forth is, what is the guidance when we experience extreme heat and weather events that impact our air quality? And I wonder if one of you or several of you could answer that, but also maybe lift up some specific examples of what's going on locally. So I don't know who would like to take a shot at that first.
I can begin. So when when air quality is extremely bad, for example, during the wildfires where the card showed up as red, our sensors bubbles will show up red as well. And so the advisory really is to try to limit being outdoors if you are asthmatic or have a vulnerable condition, or you are a vulnerable population. Then you should not be outside. Try to limit those interactions, having physical activity outside, for example. And also, if you are asthmatic, being aware of your triggers, of your asthma plan, and continuing that effort. I know last year, and maybe I'll bring in Sarita into this. I know last year we were contacted regarding the air quality issue due to the wildfires, and there were schools and youth groups contacting us about what advisory should be given out to students and families, such as should they cancel school, should they cancel a field day that they were having where students would be outside. And so we were really looked into well, what's the guidance for that? And it's really one of those things where we're planning that. We're in that planning phase of what should we be alerting folks. But the main thing really is if it's bad, don't be outside. Have an air purifier in your home if you can afford one. You could make one low cost. We have instructions for that on our website. And really, if you are vulnerable and have asthma, know your symptoms, know your triggers, and have your asthma plan.
Yeah. I'll add also locally, there's public health probably recommendations that you would hear on the news on what to do on an extreme heat day. There's cooling stations across the city that folks are encouraged to go to if their homes are not able to maintain a certain level of cooling. So, and we recommend folks seek those out during the time of the extreme heat days. But it's a public health, like Francheska is saying, from the public health standpoint, your health and well-being is the concern. So knowing what the triggers are and paying attention to that, seeking local advisory support, whatever is available. And also if it's extreme, I know like federal advisory would be popping up on encouraging people to stay indoors if it's a wildfire to minimize your exposure to outdoor air while we're under this advisory.
What about, Sam, can you speak to though, like the extreme heat element of that question? I mean, what goes on in our community for those really hot days? Go ahead.
Yeah, so an extreme heat is an example of which where there's not a lot of shading spaces. There's not a lot of the sun is coming down, but it's hitting our pavement, our hard surfaces, and it's kind of bubbling and bringing more heat in the environment. So we are in a city environment where we don't have a lot of shaded spaces. Tree also cleans the air, but it also cools our homes. So that lack of that covering is causing that increased heat experience. So where the temperature might be regulated at outside, if it's 80 degrees, you will be feeling as if it's at least 10 degrees hotter based on where you are. So you are in a desert location where you're exposed to the sun, and you are in a flat top environment where the heat is being absorbed, but also bringing back up, you're exposed to extreme heat. So we've done an extreme heat tabletop exercise with Healthcare Without Harm to kind of understand what is our community response when we are having those extreme heat days. These advisories have led to conversations, have led to us thinking about creative solutions to inform community about how to keep cool and stay out of the environment of extreme heat. And also, where are the resources for folks to go to tap into things that could keep them cool, like cooling stations. So that's what the experience is. And it's because, again, we live in an urban environment where that's likely to happen. And if we were further out in shaded spaces, where we wouldn't be experiencing that much extreme heat. And an extreme heat day could be a heat wave. When they talk about that, we encourage folks to, again, be mindful of that being ongoing. And vulnerable communities are also the one with respiratory health issues, folks with asthma, COPD, respiratory health issues that could then experience, and the negative health outcome is like a heat stroke. You know, being outside for a long period of time, your body becomes irregulated and you can experience a heat stroke.
Oh, okay. Thank you for that very thorough answer. Another question has come in. Are there any initiatives to increase adoption of electric vehicles in the Valley? It seems like vehicle exhaust is a huge contributor to air pollution, of which your slide showed, Krystal, with the rush hour traffic. I think that was your slide, maybe it was Francheska's. But are there any initiatives or efforts or policy action that we should alert people to?
I'll chime in, chime in too. So we're building, we had the Industrial Revolution. I was talking to somebody, now we're going through the clean energy revolution, that we are building the infrastructure while we are transitioning. So there are charging stations that we have to build an infrastructure of charging station. We have to provide incentives for communities to have rebates on purchasing e-vehicles. We've experienced in the summer and the winter that we're kind of testing out the model of e-vehicles and how the batteries do drain in the winter season. So there's incentives to encourage people to transition, and there's infrastructure that needs to be built at the same time for us to fully transition. But I can, Sarita can chime in more on the strategies as well.
So it's so interesting that you bring that up, because we've been approached because the Department of Energy Resources is looking at EV vehicles and trying to understand better how we can bring this to communities in Springfield and Holyoke, since they've been so expensive to access. And so that is something that as we're learning more about how transportation is impacting air quality, it's something that's on the agenda for our resident advisors to look at for the Healthy Air Network. And I think it's something that it's absolutely an important issue, but there's a lot of discussion, and now there is funding and support both from the EPA and from the state to really look at this for the community. So it's on our agenda for the next year for our Healthy Air Network.
Thank you. I have one more last question. Dr. Pollitt, I'm curious, from your experience working in other places, have you seen these sensors and this type of data that now is so able to be tracked and shared? Have you seen any policy change or any changes anywhere else that we might want to learn about?
There has been a growing use of these sensors, and in a realization that just because something is less expensive than what's used traditionally by the EPA for regulatory purposes, it can still provide really meaningful and usable data. And especially when we're able to handle that data properly, like all of the steps that we are using through calibration protocols to correct it, it can be applied forwards. So specific use of these tools for policy, I think, is growing as has the potential to support it as we better understand how to use them and have larger networks. So we are in a very fortunate place that we have so many sensors that are operated, perhaps one of the largest definitely within the region, and certainly one of the larger ones across the country as well. So I think there's a lot of advocacy that can be done with it, and also improved communication for increased risks, especially during these periods of wildfires that hopefully will not impact us as severely this year as it has in the past.
All right, great. Thank you so much. Well, I do want to just say thank you so much for everyone who has joined us for this past hour. And obviously an amazing team here at the Public Health Institute leading Live Well Springfield Coalition, the Pioneer Valley Asthma Coalition, and the Healthy Air Network. And as well as Dr. Pollitt from Yale. Really appreciate all of your expertise. And we will keep moving forward with solutions. As we know, climate change is here to stay. And so really thank you everyone for your work. So please don't forget to fill out the survey before you sign off. We appreciate your feedback. And check out the website for all that good information that was shared. Thank you.